There are two principal types of laser eye surgery, although there are lots of different names for laser eye surgery, which is very confusing. For example, there's Lasik, LASEK, PRK, Epi-LASEK, all very confusing. To simplify it, one should think of it as there being surface treatments, so that we essentially laser the surface of the cornea, and that's what's more commonly known as PRK or LASEK. In that procedure, the thin filmy skin, known as the epithelium, is removed from the cornea, and then the short-sightedness, astigmatism, or long-sightedness is applied on the surface of the cornea. And then, depending on the technique the surgeon prefers, the skin is replaced and the cornea then recovers. That's a very effective treatment for patients who have maybe a slightly dry eye or a thinner cornea, but the downside of that procedure is that the recovery is slower. So that for the first 2, 3, 4 days, the eyes are watery and gritty, as if you've got your contact lenses in upside down and inside out and you've slept in them. So it does take 3 or 4 days for the eyes to feel comfortable, and then probably about 4 weeks for the vision to really crisp up. So although one can be driving after 4 or 5 days, patients have to understand, or you have to understand, it takes a good month to get that crispness, but the outcome with that technique is excellent. The alternative to a surface treatment is what's known as LASIK. And LASIK traditionally was done using a surgical blade to create a very thin layer on the surface of the cornea. It's now done with a laser called a femtosecond laser. The femtosecond laser is placed on the eye and it creates a layer of microbubbles, 100 microns into the depth of the cornea. So that's just 1/10 of a millimeter. It's a tiny amount. And then the surgeon will lift that flap through the layer of bubbles, lift the flap up, and then on the underlying cornea apply the short-sighted astigmatism or long-sighted treatment, and then replace the flap. And the recovery from that is very quick, so patients are driving the next day. So you may well ask, why doesn't everybody have the LASIK procedure? The recovery is quicker. And the reason is that everybody's eyes are different. And what we're very careful about is to make sure that we select the right treatment for the right patient. And so we often can't tell until we've done all the diagnostics and we've made our calculations on the laser with the computer what procedure is best for which person.